So we're at the top of the hour, and just want to say welcome everyone. My name is Trishti Antonio. I'm Vice President of Policy and Professional Affairs with the Gerontological Society of America. We're really pleased that you're joining us today to learn more about the GSA Summer Policy Internship. I'm going to do a couple of housekeeping rules before we get started. So if you are willing, we'd ask you to each introduce yourself in the chat and let us know where you're from. And then also, we will be using the chat box throughout the call for you to post your questions. So please feel free to comment throughout. And this webinar is being recorded. And it'll be posted on GSA's website, and a notice will be sent to all attendees and distributed once the recording is available. It will take us about 3 business days to get that done. We ask you to keep your audio on mute until it's time for discussion. We also understand that you may or may not be able to have your video on for a variety of reasons. That's fine, whatever you need to do there. There's no judgment on whether you have your video on. I will just quickly a little bit about this webinar and the objectives. What we want to do today is we wanted to give you an opportunity to ask some questions prior to applying for the summer internship program of the people who have actually experienced the summer internship program. So after the welcome and introductions, we will have a discussion. I will turn off the slide deck at that point so that we can actually see one another. We'll also go through very quickly some of the process that you need to know about the summer internship, and then open it up for Q&A. I did want to mention to you that the summer policy internships are named in honor of and in memory of GSA past president and board chair Kathryn Hyer, who was from the University of South Florida, and GSA's director of the National Academy on an Aging Society, Greg O'Neill. So you can learn more about Kathy and Greg on our website. We are pleased that this year we have 3 internship positions available, and I'll talk more about that later, and there's definitely information on our website. We are pleased that this year one of the interns will be selected from a minority serving institution. So that's some of the detail about us moving forward on this. So without further ado, these are all our lovely pictures, but I'm going to take the slide deck down so that you can actually see our colleagues in person. But just wanted to be sure that you knew who is who before we started to have the discussion. So with that, as I transition, Haley, can you introduce yourself?
Sure. Hi, everyone. I'm Haley Gallo, and I'm in my final semester of my PhD program at the University of Southern California. I'm in the Leonard Davis School of Gerontology. And I don't remember what I was supposed to say other than that, but I'm excited to see you all and answer any questions.
And then Chen.
Thank you, Trish. Hi, everyone. My name is Chen, and I'm a doctor candidate of social welfare at UCLA. And I'm a transdisciplinary and cross-cultural researcher, and my research interests including social policy, long-term services support, immigrants' access to healthcare, and cross-cultural studies. And I'm interested applying for this intern because of my personal experience and the previous training. And also, I want to apply research related to the policy and to inform more policies in the future. So that's about me. Nice to meet you all.
And Kaylee.
Hi, everyone. My name is Kaylee Wiggins. I am a 3rd-year PhD candidate now at the University of Connecticut in the Human Development and Family Sciences Department. I am interested in long-term services and supports, and particular spatial disparities in rural older adults. I plan to defend my dissertation proposal this semester, and hopefully will work on my dissertation this summer and into the fall. and nice to meet you all. Thank you for having me.
And before we get started, I also wanted to quickly introduce Brian Lindbergh, GSA's policy advisor, is also on the call today, and he works very closely with us with interns. So if you hear people refer to Brian, I think I just saw you raise your hand, right? So that's who the interns will be talking about. So briefly, we sort of covered a little bit about why you might have applied, but Haley, I was wondering maybe you could start as our inaugural intern. What interested you in the program? Why did you apply?
Sure. So I'm a PhD student, so that means I'm interested in research. And I love knowledge for the sake of knowledge, but I wanted to see how research was applied in practice and how research influenced policy. And when I learned about this opportunity at the GSA meeting, I guess it was in 2018, it seemed like a great opportunity, and I wanted to be able to apply research in practice. And I feel like I was able to do that during the internship.
Great, great. And Lay, how about you want to expand a little bit more? I know you shared some in your introduction, but a little bit more about what interested you.
Yeah, sure. Thank you, Trish. And actually, my research interest started from the policy's impact in individuals. And I originally come from China, and I'm the one-child generation. So I'm a little bit worried about taking care of my parents when they become older. So I started notice the policy's impact may impact every individual. So I got a training from different fields: sociology, social policy, demography, and I know GSA is a multidisciplinary group. And so when I come to the US to take my master and PhD, I get know more about this organization from the annual scientific meeting. And when I see the post of this policy intern, I'm very excited because this provides me a chance to see the policy legislative and the implementation and other related field in the US. And it will help me to bring a comparative perspective across nations, and also between the California I'm right now and from the state level to the national level. So, and also I'm very passionate about applying research into the field. As Haley said, I really want our research will help the people, help older adults and in the real world. So that's why I would like to get more insights from this internship. And I really get something, and we would like to share more. So this helped me to learn from this internship and apply for this.
And Kaylee, how about you? What specifically?
Yeah, so as Haley had said, PhD students are typically interested in research, and I'm certainly not alone in that. I started as a clinical research assistant at UConn Health in the Center on Aging. During my master's program, I had found this internship through GSA back in 2019 when the first applications were due. And I didn't apply to that round, and due to COVID was canceled for 2020. So when I saw it for 2021, I was really, really excited. I plan to pursue a non-academic career after my PhD. So I plan to go into industry or some sort of think tank application as opposed to the academic tenure track route. So I really wanted to gain more experience with policy on the ground level. And as Lay said, there's many things that we can share that we actually did do during the internship, but I wanted to see how policies that I had worked on through Medicaid and Medicare policies, how they were developed and how different organizations came together to support those policies. And I certainly did learn all of that, but I also was interested in the Gerontological Society of America altogether and seeing how what I consider my home organization and in this field, how it worked and what the behind the scenes sort of looked like. So that's why I applied. And as I said, didn't apply for the 2019, but when it came for 2021, I was ready with my application. So I was very excited.
So thanks, Kelly. And in fact, I think I want to ask you to expand a little bit more on the behind the scenes. What was your daily work? What was your work like daily? Can you describe that for people? And I'm wondering if you can kind of give us an idea of what your daily work was like as compared to what you thought your daily work was going to be like?
Yeah, I think being virtual for the 2021 session due to COVID did not hinder my experience at all. Trish, Brian, and the team really did allow us to see many different aspects of GSA and policy related to aging organizations and such. So I was first exposed to the breadth of the aging organizations that exist, and also learned a lot more about the partnerships that GSA has with other aging coalitions. So not only sitting in on those meetings, but meetings talking about projects that they were working together, or meetings that were for the public, getting to sit in and be exposed to those things that I hadn't been exposed to before. But also on the policy arena, both sitting in on congressional sessions, but taking notes on them, and then reporting back to Trish and the team in order to help us understand what's going on the policy level. All of those things sort of were different every day. So it would be, if it was a session one day, I would take my time to write my notes and summarize that. But every day looked different as far as who and where and who I was exposed to.
Haley, you're shaking your head up and down. So I was wondering if you could add a little bit to that, in particular, since you were in person in Washington.
Yeah, sure. So like Kaylee said, every day was a little bit different. I had a project that I was working on for the entire internship, and I would work on it here and there. But then it was a lot of going to the Hill and attending meetings and having meetings with other aging related leadership organizations. We had meetings at the White House, we had meetings on Capitol Hill. And when I was there, Trish and Brian were working with some other aging organizations on requesting language for the Older Americans Act reauthorization. So I got to support them in that effort. And Trish, I do remember eating lunch in the break room one day, and you came up to me and said, I can't attend this meeting on the Hill, so I need you to go, and don't let Brian give up this piece that we're trying to negotiate. And I remember being like, I'm the intern, I don't know how to negotiate that kind of stuff. But it was a really great opportunity to kind of like be thrown off the deep end and really see policymaking in practice.
Well, I guess, so I would comment that we never feel like we would put somebody in a position that they wouldn't be able to manage or handle. And one thing I hope that you would all hear is that we have a really good camaraderie in the office, whether we are in person, all in the office, or if we are dispersed and we're on different calls. So it's always good. And Brian, I don't know if you want to comment on how far we've come with the language in the Older Americans Act to support the Research and Demonstration Center reintroduction. So
sure.
Yeah.
Well, thank goodness I didn't give up that provision. I'm not sure exactly what that was, but anyway, we were successful in getting a nice piece of legislation into the Older Americans Act, and it created a new Center for Research, Demonstration, and Evaluation, which in the Build Back Better bill is funded for $75 million. So that's just one more reason to support the Build Back Better bill. It hadn't, this new center hadn't received any regular appropriations yet. So, but really, Haley was, involved in all aspects of that. She helped edit the bill. She did a side-by-side on some other proposals that we didn't like as well, and really helped us put together our presentation. So if the opportunity comes along, we're not afraid to really put you right in the middle of it.
So thanks, Brian. Lay, maybe you could add a little bit too about your experience, about what you expected day to day and what your daily work was like, especially since you were in California and the expectation is that you have to be able to participate in an East Coast time zone.
Yeah, actually the time difference was a little bit challenging for me, but I think it's fine because Trish is very accommodating and I was not assigned a very early meeting at that time. So it means that we have some flexibility for our internship because we were assigned for some meetings to sit on and hearings, but for other time we have some flexibility to arrange a time, like you may like make connection with the people you want to connect, like organization leaders you want to talk about, and Trish will introduce you to that person. And also like I work with Kaylee together for some tasks. Like we also have a big task like writing policy briefs and follow up with the budget process. So this is like you have a different, like I think the events or things to do, like hearing during the meeting, and also work together for a big project. And also you can think about what may interest to you. You had flexibility to do that part. So this is really a very, I think, colorful like experience, not only like just one task each day. Like it has like a lot of differences every day.
So thank you. I'm going to put this question out to all of you, and whoever wants to jump in first, go right ahead. So there's definitely an expectation about what an internship will provide. Like what did you find most challenging there as far as the internship? And what's, I do want to dig in a little bit more on some of the surprises. Like, so your expectation is this type of an internship. I want to dig into that a little bit more. So anybody wants to, like, what did you find challenging? Because you're all saying it was such a great experience. I know there was something.
I'll just say, I don't know if I'm speaking on behalf of Haley and Lay, but as a graduate student, we do have schedules, but we also have some flexibility in our schedules. So we're able to work on the weekends or able to work in the evenings or when we'd like to. But the expectation to work almost a full-time job during the summer was a bit of a challenge. I think all of us probably had school responsibilities over the summer as well. So learning how to balance those things was challenging. But to say, to back up what Lay had said also, the flexibility we were provided on which sessions to attend and how we could integrate our work was definitely flexible. So while we had the expectation of being available as a full-time position, the burden of the work was absolutely manageable during that time period.
I will
Anybody
build
else?
on that and say that over the summer that I was there, I was supposed to be studying for my qualifying exam, and I was, but I think, you know, it was difficult to manage my time in that way, but doing the internship also helped me study. Because over the course of the 6 weeks, I think I read every issue of the Public Policy and Aging Report, and I wrote memos and like summarized a lot of them. And so that was helpful for me to study for my qualifying exam, like while I was doing the task that I was supposed to be doing at my internship. And then the things that I got to work on influenced my research, and now I'm doing my dissertation. I think my dissertation would be totally different if I hadn't have done this internship. So I'm really grateful that it worked out that way.
Yeah, for myself, I think one challenging part is writing because it's different from academic writing we're familiar with as the graduate students. So at the beginning, Kaylee and I, like, we are thinking about how we will write this kind of like common letters or the policy briefs, because we like previously we write the academic paper. But the great thing is that we can communicate with Trish like very often. So we list some points and have the outline, and we have some draft sentence there, and Trish will help us and encourage us to write in a way and fit for that particular kind of like document. So as the time goes by, I think we are more familiar with some like common letters, policy briefs, and others. And then when we started, we are a little bit nervous at the beginning about not sure how to write this kind of, different types of the documents.
that is interesting that you mentioned that. And I think the one thing that Brian and I try to do is help you work through that and see the difference. But really, it's meant to be a learning experience, right? So it's not there's no grades, right? And it's really something for you to kind of see like how we have to translate when we talk about translating that research into evidence-based policy. What has to happen there for us to be able to talk with staff on the Hill or members of the administration. So yeah, so it's really, hopefully, yeah, we were helpful and in that. So I'm glad to hear that. Before we turn it over to others, I was wondering, what was your biggest takeaway from the internship? Like, if there was something, like I hear some things that maybe it changed how you are conducting your research. Is there anything more that you can expand on that? And I'll let you guys jump in as you want.
I know for me, as I said, seeing behind the scenes of GSA was really important, but also really acknowledging, as you said, the camaraderie of other aging organizations, seeing how organizations work together to support certain policies or to introduce new policies or to really, again, work collaboratively. That was really surprising to me. Not to say that I didn't expect that organizations would work together, but just seeing the sheer number of organizations that do work together, that work on similar or different policies. Can you help me draft a letter here? I'll support you on this. Can you, draft some information over here? And again, that was really surprising, but also the number of organizations. I've been exposed to GSA for quite a number of years now, being a student and working in the field, but seeing the number of aging organizations or organizations that are aging related, that was really important for me to see, and something I probably wouldn't have seen if I didn't have this level of exposure.
I wonder, can any of you give, is there like something specific that sticks in your head about other organizations that you were surprised we were working with, or how that was?
Before the internship, I thought GSA was just the organization that put on conferences and published journals. So during the internship, I realized that GSA is a member of these coalitions of other groups that have similar goals. So I remember attending a meeting with people from a lot of different organizations, and it was all about protecting patient access to pain relief. And there was a wide range of organizations that were involved in that meeting. And we got to meet with Kellyanne Conway's staff at the time to talk about that issue. So that was like something that I just did not expect to do at GSA. I thought it would mostly be related to disseminating GSA members' research, which we did, and influenced our the way that we approached each of those meetings. But yeah, I was really surprised to see the number of aging organizations and aging related organizations that GSA works with.
So just to give you an example, with that coalition, we work with the American Association of Kidney Patients, we work with Chronic Pain Nurse Management, we work with specific patient advocacy groups. So the patient groups that are involved that represent chronic pain groups. So it really is kind of a different picture. Does somebody else want to add to that? Anything?
I'll just say that one of my interests in research in general is social isolation and loneliness, and learning that there was an organization newly developed actually that's focusing on that was really important for me to see, but also to see that we were bringing the aging piece of it to not let older adults be forgotten about in that discussion. So while we know that social isolation and loneliness is a problem for a public health problem really amongst all populations, GSA is really pivotal in advocating for older adults, and being part of those discussions and seeing how GSA is again advocating for older adults was again really important.
Thanks. Lay, anything you want to add?
Yeah, related to that, I remember like Trish, you introduced like PIF, like organization advocate for the immigrants. So after that, I subscribed their newsletters and also other like related organizations. I think for our graduate students, you may feel like sometimes isolated only in your small like field of research, but like through this experience, I get to know more like organizations related to the issues you're interested in, and you may get more, not only from GSA, you will get know more from other organizations through their newsletter, and you will get more information like webinar and other like policy advocacy they are doing now, and you can engage in them even after the policy intern. So that part is really helpful. So yeah.
Great, thank you. Haley, you mentioned that you even sort of adjusted your research a little based on the internship. So I was wondering if you could talk a little bit about how you think this internship helps or relates to your research and your career development.
Yeah. So before the internship, I was not sure if I wanted an academic position or a non-academic position. And I was mostly focused on age-friendly communities. But then during the internship, I was reading legislation related to the Older Americans Act. And that was right before I got to work on a project related to area agencies on aging with my advisor. And so that really laid a foundation where I got to actually read the Older Americans Act and really understand the background of why AAAs do what they do and how they're structured. And now that's what my dissertation is on. And I've always been interested in the intersection of research and policy. And I got to actually do that at GSA. And now when I graduate, I'll be a Medicaid researcher with an organization called Mathematica. And I think during my interview process, when they were asking me questions, a lot of the things that I talked about were things that I did when I was doing the internship with GSA. So I'm really thankful for that opportunity.
Thank you. Kaylee or Lay, anything you want to add to that?
Yeah, I want to say that a big takeaway for me is I have more confidence in my research, and I think it will really make meaningful like impact to the field, because when previously I do research, sometimes I'm thinking about how I might write my policy implication and others, and because I didn't have the real like experience in the policy field a lot, but this policy internship make me to think abroad. And I remember my advisor always say that even your research is a very narrow topic, but you need to go back to think the big picture and how it may impact the real world, the large group of people. So this experience may really help you to think big, but also go back to your like everyday work of research, but bring these things in your mind and have more confidence about your research, and you are saying it's meaningful and helpful.
Kaylee?
Yeah, as far as my career development, like Haley said, I started sort of ambivalent at the beginning of my PhD, and decided right before applying to this internship that I wanted to pursue a non-academic career. So this definitely gave me the confidence in doing so, seeing the number of organizations, not only GSA, but other organizations like Mathematica or people or organizations that do policy research, that definitely solidified my decision and my career path. And I'll say I also, as I said, worked as a clinical research assistant. And after my internship, I actually went back to the Center on Aging at UConn Health and told them all about my internship. So they got to learn more about GSA and about the things that I did during my internship. So it helped me to sort of relate what I did there to the internship and back. So I think that was really full circle opportunity for me too.
That's fantastic. Thank you for sharing. I want to get into some little detail here in that the in-person and the online internship, and also working with another intern. So how did that help? What did you think when you heard, so for Lay and Kaylee, when you heard, oh, we're accepting a second intern, how did you feel that would impact your work? Haley, did you wish you had somebody else to work with? Like, I mean, how did that, so I'll start with Lay and Kaylee there about working together and all.
Yeah, it was really a great experience to have like Kaylee work together. Like Kaylee is a very well organized and proactive. And so every time she started like leading like this process, it makes me feel really comfortable about working with Kaylee in this process. And we discussed some questions, and for every task, we will arrange small meeting and to make a plan and which part we do. And then we come back to discuss our thoughts and our progress. So it's really a great like dynamic, even though it's virtual, but I feel close with Kaylee when we're at the East and the West Coast. So I think that's a really nice experience if you have someone working with you, because you may be nervous or sometimes, but you have a person to share these feelings and you improve and learn together. So yeah.
I don't think I could have said it better. I think everything that Lay just said is exactly how I feel. I think we both have our strengths and we both have different interests. So we were able to highlight some of those in some of the projects that we did, and working collaboratively, as she said, on different coasts was never an issue. I actually started 2 weeks earlier than Lay, and Lay ended 2 weeks later than me. So I think we did have a little bit of an individual experience just based on the timing. But when we got together was when we really focused on these projects and were able to accomplish a lot of the goals that we had. So I think over and above, I would suggest having more than one person to work with, because as she said, if I got nervous, I wasn't doing something correctly, if I missed something, we had each other to bounce ideas and thoughts and feelings back and forth. So it's really great.
So Haley, you were on your own. Any comments?
It would have been nice to be able to, bounce ideas and collaborate with another intern. But I will say everyone on the GSA staff was really welcoming and helpful. And so if I ever had a question or ever wanted to, needed a sounding board, everyone on the GSA staff was always willing to do that. So I didn't feel like abandoned or alone without another intern.
That's great. And this year, I think with the opportunity for us to be able to have a third intern, there will be more opportunity for collaboration. And it's my hope that even the interns will continue to reach back to you guys, right? Because of your experience in this year. So tell me about networking and the internship. So you talk a lot about the GSA staff, you talk about, working with me, working with Brian, but what about other networking opportunities?
Trish and Brian helped me set up and really encouraged me to set up meetings with staff on the Hill from both political parties and both chambers. And so that was really eye-opening for me to be able to see who's really laying the groundwork for all of the things that we're doing, and it's mostly Hill staff. And so I came in with my own political leanings and ideologies, but I got to work with people who shared my opinions and people who had different opinions, and it was all with the goal of making life better for older people. So having that opportunity to network with people who I wouldn't otherwise have ever met was really valuable.
Claire or Kaylee?
As we've said many times, sitting in on these different meetings is really interesting. Seeing some of the names that I've cited in some of my school papers or cited otherwise, maybe seen at a symposium at GSA, but actually seeing them on a Zoom call was so surreal at times. And I think you had said before, these people are just people that recognizing that we're all on the same path and that we're all trying to, as Haley said, just improve quality of life and experiences for older adults. So that was really interesting to see, again, people in their own element and on Zoom or wherever else. But as far as networking goes, I did meet with GSA staff to learn more about their jobs, again, to learn behind the scenes, as well as the organizations to learn how their daily operations work. So it was really great to see all of that.
Anything else that you'd want to add before I pivot to just the details of the internship? And Brian, if there's anything that you'd like to add, please do so. Okay, so I'm going to quickly share my screen and hope that this all works out the way it's supposed to. Let me know if you're not seeing the right screen. So just quickly, all of this is up on our website, and Leigh is going to drop the slides in for you today because there's some links in there that'll just make it easier for you to find things. If you haven't taken a look, the qualifications for the internship include that you are in a master's or doctoral level, studying gerontology or an age-related field. We want to hear in your responses about your interest in policy and either legislative and or regulatory affairs. We're also looking to see your written skills. There is an in-person interview, so we'll look to see how we're looking for someone who has some presence that would be able to go out and represent us at a meeting, right? At this point in time, we are looking for interns to be here in Washington, D.C. We continue to closely monitor CDC recommendations. We are a dispersed office at this time, which means that we are working off-site. And at this point on the Hill, there are very few meetings that are in person on the Hill. Most of them are Zoom. So we'll continue to monitor that and consider that as we move forward in the process. We do give preference in the application to applicants who participate in GSA activities, right? So if you have colleagues who are not GSA members, they are welcome to apply, right? So this is open to anyone. We do have that preference because we know that these are people that are you're openly interested and active in GSA. And as I mentioned at the start, this year we are taking a third intern. And of the 3 interns, at least one will be from a minority serving institution. And so that's new this year. The application due date is 5 p.m. Eastern time on February 7th. We anticipate reviewing the applications, going through the interview process and identifying someone on or about March 1st. But that will take time depending on how long it takes to get interviews set up. The links in here, if you have any other questions, please email us at it stands for professional affairs, but profaf@geron.org. And there is more information in the application link for you to be able to go through that. With that, I'm going to stop sharing my screen and we can open this up for questions. I'm going to look real quickly, but I didn't see, last I looked, I didn't see any questions posted in the chat. But if anybody has a question, please just raise your hand and we'll recognize you and try to answer your questions as best we can. Hi. You're gonna tell me how to say your name.
Hello, my name is Mengzhao Yan. I am from the Leonard Davis School of Gerontology. I come from the same lab with Haley. So yeah, we are working on in the same lab. So, my question is, are international students eligible to apply for this program? So not citizen, not permanent residents. Are we eligible to apply for this program?
So the qualification is that you're enrolled in an accredited institution of higher learning in the US. So you're in a program here.
Yes, I'm in
So
the.
then, yeah, so then you're eligible to apply. That's really what it is we're looking for people that have that are in a program right now and US based because it's US policy that we're working on. So I think it's easier. But I don't know, Lei, if you want to share your experience.
Yeah, I think Mengzhao, you don't need to worry about that. I think if, as Trish mentioned, if you are in a US-based a university and a graduate student, you can apply for this. Yeah, no worries.
Thank you so much.
Sure.
Because NIH, their grant programs for students, they require you to be permanent, at least permanent residents to receive those. So I'm wondering if this program has the similar requirements.
No, we don't have that requirement at this time. Anyone else? Thank you for your question. Okay. Hi.
Hello. My name is SJ, and I have one question about the timeline for the applications. For example, if there is an interview for the application, when it will be, and when the result is announced, something like that.
Right. So all of that information is up on the website at the bottom of the page there. So what we'll do is we'll review the applications. We will select a number of those applicants that we feel like on paper look to us that we should do an interview. We'll set those up in between February 14th and 22nd. And so, I mean, we work with everybody's time and we conduct those interviews over Zoom. And it's not only Brian and I who are participating in those interviews, so we have some other colleagues who participate with us to help us make the decisions and the recommendations for the interns. And then we will announce, and I say on or about March 1st, because if I gotta like get everything all coordinated for the emails, but we notify everyone. So, and I, in the sense of those that are successful, those who are not successful this year. So, and it doesn't preclude anybody from applying another year if you're still part of the qualification. So don't feel like, oh, I applied last year and I didn't get accepted. If you still fit the qualifications that are defined, please apply. So that's all defined on the bottom, and we try on or about March 1st to make you aware. If it's going to be delayed any further from that, we would send a message to all applicants. Make sense?
I have one more question, so it will be very miscellaneous question, but how many people or students are applying this program? So how competitive is the program?
So I think it depends on a couple things. Year one, I think there was, I'm not sure if people, so there were a couple things that probably impacted the number of applicants. We didn't have as many applicants in year one. It was very new. It was announced in November and we were interviewing people by February, right? So also we know that we had the requirement that you had to be in Washington, DC, which we feel like that may have impacted the number of applicants. In year two, we probably had close to 40 applicants, right? But we also were, because of COVID, we were saying that you could be, you didn't have to be in DC. You had to be available to participate in meetings that were on the East. You had to be available for East Coast meetings, right? So it's one thing, and Lay and Kaylee were really nice about saying, oh, I was really flexible about setting up meeting times. But, you know, if the White House sets up a meeting and it's at 8:30 in the morning, guess what? We're all there at 8:30 in the morning, right? So, you know, and if you think about it, that decision, that would apply to interns, but that would apply to anybody on the West Coast or beyond to listen in on a call there or something like that, right? So that's kind of what we think impacted the number of applicants here too. We also think that, you know, word started getting out that it was a meaningful internship, and that helped. Does that help?
Yes, it helps a lot.
Good. Chelsea? I see Chelsea Dixon has her hand raised.
Yeah, hi, my name's Chelsea. I'm an MPH candidate at University of Pittsburgh, and I'm also doing a certificate in gerontology. I'm sorry if I missed this, but I was just curious to hear a little bit more about what the kind of the day-to-day activities look like. It sounds like a lot of meetings and just talking to people, but I was hoping you guys could speak a little bit more about that.
So I'll let you guys take that question, and then I can always round it out.
If anyone's curious, I kept track of everything that I did in the internship. So I actually have an Excel sheet of all the meetings that I attended and a couple notes on some of them. So I'd be happy to share that with anyone. But I think for Lay and I, as far as the virtual, as we said, we worked on a couple projects throughout the entirety of the internship over the summer. So balancing those with scheduled meetings or sessions that had been recorded and watching those, really whatever Trish would think would benefit the project we were working on, or other projects that she needed information on that we were able to attend and summarize. So again, I have a list of everything that I attended and did, but it really, like a full-time job, just managing all of those things within the time parameters that we were there.
And I worked on a couple of projects. So one of them was related to preparing a public policy and aging report issue for the 75th anniversary. So that's why I was reading a lot of the older issues and had a spreadsheet, you know, tracking and kind of categorizing them into different groups. And then I worked on writing like 1 or 2 page like summaries of those that we could share with Hill staff. And then I also worked on planning a session for the annual scientific meeting, you know, in addition to attending meetings as they came up. And I'll include my email in the chat in case anyone has any questions, but I have to go run and prepare for another meeting. So best of luck to everyone.
Thanks, Haley. Lay, did you want to add anything?
Yeah, if you want to know like what a typical day of like internship like, you may have like 2 to 3 meetings, and you will work on some big projects, and also some like if there is something new happen, like we prepared like FAGHE, like our CEO's presentation in front of NIH. So then you will have this new task come into your daily work. So but sometimes you will have more meetings in a day, but sometimes you will have less meeting and you can spend more time on the projects and tasks you want to do. So this is like the typical work, and you will feel like your day is like full of a lot of things you can do, and the time will go very fast for the internship.
So Brian, do you want to add something? Is that what your hand up?
Sure. Thank you, Trish. I could just mention a few other things. Haley, for example, also helped me on an article I was writing with a researcher at the Virginia Tech University on elder abuse. So and the opioid crisis. So there's all sorts of opportunities that come along the coalition work that we do involves, in some cases, reading letters, editing them, helping us decide whether GSA should sign on to the letter. Obviously, there's some meetings involved there. The good thing there is, particularly if we get back to in-person meetings, is the networking opportunity, because, for example, the Leadership Council of Aging organization has more than 60 members, and we have monthly meetings in addition to the committee meetings, and you'll actually meet some really top-notch policy people here in DC in the aging space. There were opportunities, and there will be more, I think, this coming summer, to do legislative analysis, which is really helpful to us. And I would say another thing that, from our perspective, that it's really refreshing and energizing to us to have new brains looking at some of the issues that we look at on a daily basis, and hearing the perspective of someone who's doing cutting edge research right now in their careers. We always say, information matters, and we have staff people on the Hill who really rely on us for good data and things. So you can be really helpful to us in getting people cutting edge information that they can use in hearings and briefings that they do. So anyway, there's a lot of potential there. And sometimes we have members from GSA who are coming to DC to testify. And often there's an opportunity for all of us to assist them, either in giving them feedback on their testimony or helping make arrangements, covering the hearing, helping Todd do an article for the newsletter. So there's just a lot of opportunities. GSA can't cover every issue because we have members who are really every aging issue you can think of. We can find a member pretty much who's either teaching about or doing research or is in some sort of practice related to that issue, housing, whatever it happens to be in the aging space. But because of that, we also can try to adapt and be flexible. If you have a particular interest, we may be able to find an avenue for you to expand on that and interject it with the internship here in DC.
Thank you. That's helpful. Yeah.
Yeah. The one thing I would add, or a couple of things that I might add to that is, so we have regular check-ins with the interns. And so maybe the end of the day, every day, just like a quick check-in I would do to say, okay, what questions did you have about today? So you're not, you have independence and some flexibility, but you're also connected pretty regularly. I share my calendar, and basically, GSA is involved in around 30 coalitions. Some are aging related, and we're representing gerontology. Some are, as we heard earlier in the reference, we're representing aging in a larger community. So in an oral health or in pain management or adult vaccines, we represent aging in that room. So we may have those meetings that are occurring regularly, participating in those. Maybe there's an offshoot of a project that comes from there because we hear something that's mentioned about a gap that people don't understand. So right away, we would just start to work on getting the materials together for that. So it's sort of the day is somewhat flexible in that you're responsible for you're responsible to get your work done, right? And we're looking at calendars on the Hill. We're looking at different meetings that may be hosted by different organizations covering a topic of interest. So whether that's early detection of cognitive impairment, CMS is looking for comments, AHRQ is looking for comments. How are we trying to cover as much as we can around aging or direct maybe an interest group of our direct that information to an interest group of our membership and work with them to develop those comments to submit. So we rely on our members for the expertise, and they rely on us for the understanding of how to frame those messages so that they are, when they're submitted, we get good feedback and Congress and the administration recognize to continue to reach back out to us. So it is kind of an open, flexible. There were some times Kaylee and Lay would say to me, do I need to be at this meeting? And I'd say, do you want to be at this meeting? And they'd say, well, I have this other stuff to do. It's like, okay, you don't need to be at this meeting. Or sometimes I would say, yeah, you really need to be at this coalition meeting. So remember this project that we're working on to write a brief. It's going to help you understand so much better. So it's not meetings for meeting's sake. We really do value all of our time. So we want to make sure that we are going to the meetings that are going to help us advance our work and our members, our members' work and our mission, right? So it's hard to kind of really get very specific as far as a day in the life, but I could tell you this: in the morning, we could be focusing on adult vaccines. In the afternoon, in the midday, we're talking about the Older Americans Act program and the Aging Network. And then a half hour later, we're talking about early detection of cognitive impairment. So it can really be that broad, yet we represent a very specific area of interest in those meetings. So that's kind of why when everybody said, well, I had meetings all day, this is kind of what it does. And I think this is what makes it interesting for our interns to come in and learn how GSA is covering a little bit more broadly issues to represent our members, right? So any other questions as we're wrapping up? I can't believe the hour has gone by so quickly. Okay. Lay, Kaylee, anything you want to say as we're wrapping up? Anything you want to add?
I would just say, if you have an interest, apply. Don't take a second to think about it. Just get your application materials together and put it out there, and you never know what'll happen. And best of luck to everyone.
Yeah, and welcome everyone to apply for this great opportunity. And if you have any particular questions, like I'm also happy and available to answer your questions. And I will put my email in the chat.
So just a reminder, we did record this. You will get a message when this is posted on our website. You all have the slides. The slides will be posted again. Those slides provide the link to the webpage where the application information is housed. So we look forward to reading your applications. Thank you so much for joining us today. And with that, I wish everybody, have a great weekend. It's Friday, right? Have a good weekend. Bye.
Bye.